I want to welcome you to our Friday press briefing with COVID-19 updates. As many of you are aware, yesterday, probate court judge Nancy Stevenson transitioned, and we are all mourning. Judge Stevenson was a kind and caring person who will be missed greatly by our community and everyone that knew her. Please join me in a moment of silence for Judge Stevenson and the family that she has left behind. Thank you. Now we will hear updates from our community leaders. We will start with Mayor Bo Durr, Mayor of the City of Albany.
Thank you, Mr. McCoy. I want to start off by extending my condolences to Judge Stevenson's family. Judge Stevenson was kind to me when I first came to Albany in 1987, and she remained a friend of mine up until her passing. Nancy was one of the few people that probably had no enemies. You wouldn't hear anybody say a bad word about her, and we all mourn. Judge Stevenson's death brings us, many of the people in the community, to the next phase of this battle, because now we know someone who has been a victim of COVID. We understand, we think about the fact that the Stevenson family will not be able to accept friends and family to grieve together. But Judge Stevenson is only one of over 30 deaths in this family, this community, the families that have dealt with this. And we also are entering another phase because, as most of you know, at 6 o'clock p.m., the entire state will be under a shelter-in-place order. It takes effect. Governor Kemp, after some deliberation, has made the decision to enact these restrictions, impose these restrictions on the entire state. Speaking from Albany, it's easy for us to say that is the appropriate decision. Much of the state, if you look on the Department of Public Health website, some counties have only a handful of confirmed cases. But what we know from our experience is, once the first cases are diagnosed, there are many other people in the community who have the virus. I want to say something, and I'm not asking for recognition or praise or acceptance, but what we did here in this community, and granted it was somewhat out of necessity because we were a hot spot for COVID. Almost 2 weeks ago, we took steps to restrict movement and to require citizens to modify their behavior. I truly believe that some lives were saved because these measures were implemented here in Daugherty County before we had to do so. I also want to say, and this is not something, it's difficult to say, but I want to express my opinion that those people in the community who have disregarded the shelter in place because of what you have done, your recklessness, probably other people are going to die. Because we now know that this incubation period, the experts are saying now that it's possible that the virus is spread not only by saliva or projectiles, it could be a human's breath. So with that, I just want to say, and I'll let the chairman, if he would like to go into the details about the executive order, but we need to look for guidance. The definition of essential businesses is narrower than what we had in our executive order. The governor has directed the public to seek clarification. Basically, what is deemed a critical business is almost synonymous with what the Homeland Security defines. And so I would urge the public to look at that. We've had problems with what is and what is not an essential business. I think this issue is now to be determined according to the state order. I won't go on and on, but I want to say that our city employees, we are doing everything we can to protect those people who are assuring that this city continues to operate. The community depends upon the city for water, for electricity, for public safety, for fire protection. And what the city manager has done is she's in the process of sourcing masks so that anytime our city employees are out in the public, they will have that mask to protect not only themselves, but the general public. And I want to say, I don't know what the next 2 weeks holds. Some people say that within the next day or two, we should expect some decline in the number of deaths. I don't know that that's the case. We'll hear from Dr. Kitchen, and up till today at least, Phoebe continued to have more admissions than discharges, which is not a good sign. But one thing I want to point out, I checked on the Department of Public Health website before I came here. I want to mention the 6 contiguous counties. Baker has 4 confirmed cases, 1 death. Calhoun, 10 confirmed cases, 1 death. Lee, 115 confirmed cases, 8 deaths. Mitchell, 43 confirmed cases, 1 death. Terrell, 50 confirmed cases, 2 deaths. Worth County, 30 confirmed cases, 1 death. Now, what do these numbers mean? The fact of the matter is testing is much more accessible here in Albany than it is in surrounding counties. So the numbers of people with the virus in the surrounding counties is probably substantially higher than what the confirmed cases are. And the staff at Phoebe Putney is going to be prepared for a second rush of patients from our surrounding counties. But that is why I am grateful for whatever precautions the surrounding counties have taken, but grateful for the action that the governor has taken, because beyond our contiguous counties, there are other counties, and this virus has a ripple effect. It knows no boundaries, and I applaud the governor for taking these steps. I thank you for your attention. I want to tell you how much we appreciate your continued cooperation for the vast majority of citizens who have complied with the executive order. I do want to say that we are no longer talking about an executive order implemented by the chairman of the Dougherty County Commission and the mayor of the city of Albany. This is now state law. Familiarize yourself as best you can with the provisions of the shelter in place so that you can protect yourself and others. Thank you, and God bless.
Thank you, Mayor Dorr. At this time, we will hear an update from County Commission Chairman Christopher Cohilas. Mr. Chairman.
Thank you, Mr. McCoy. Thank you, Mr. Mayor. This community is in mourning. We have lost a tremendous jewel in our community, a jewel to the people, a true public servant. Judge Nancy Stevenson has served this community for a very long time as an outstanding probate court judge, as a volunteer, as a nonprofit board member, and just as a citizen, a mom, and a wife. And I was proud to call her my friend and my neighbor. And this community truly is at a loss. And I think that her passing highlights exactly how lethal this disease can be and how lethal this virus is. And we know that her loss is not the first and it's not the last. And our hearts go out to each and every family that is dealing with the aftermath of a passing of a loved one. This is an extremely hard time. Know that we understand that and we appreciate the losses that you're experiencing, because we know these people and it's affecting our community. And unless we continue to be disciplined, to continue to enforce the rules that we have in place, we're going to continue to suffer these types of losses. As the mayor pointed out, yesterday Governor Kemp took executive action issuing a shelter in place for the entire state of Georgia. What does that mean? Well, he's issued a very lengthy order that applies to the entire state of Georgia, not just one county, not just one city, not just one region. We have already been dealing with this. That's why Mayor Dura and I worked very hard, very early on, to issue our first executive order as early as March 19th. There are going to be some differences between what the governor issued and what we issued. The governor has the right, absolute right, to issue an order that applies to the entire state. I, along with Mayor Dura, thank the governor for taking this action because it will provide regularity to the entire state. It will provide us guidance and will allow us to, as a state and as a region, have the same rules apply to everyone. That's a good thing at a time of crisis. We really appreciate and need that. And it makes it easier when there are one county does one thing and another county does another thing. Now the rules apply to everybody all the same. So that provides a consistent result for everyone. And I'm very thankful for that action. And I'm also thankful for him for the resources that he has continued to provide this community. And we continue to remain in very close contact with him. There's going to be a transition period for many of our businesses and our citizens as we absorb as a community the difference between the order that used to be in place and the order that the governor has issued. The order that the governor has issued in some ways is more restrictive and in some ways is slightly less restrictive. This is a process, and so to highlight some of those issues, I know many businesses already have questions. I'm getting phone calls saying, well, the governor's order says this, but your order says this. Here's what we're telling folks to do. Businesses who need clarification need to contact the Georgia Department of Economic Development at 404-962-4000 for guidance. Again, that is 404-962-4000. That's the Georgia Department of Economic Development. It is one of the branches of the executive government. It's the branch that the governor has set aside and said, look, if you have questions about this, this is the entity that you call. If you have a question about whether or not you're a car lot or a person that sells pastries, about whether or not the order applies to you, and you have a question, please go ahead and call that number. Additionally, we have some good information from the governor's office regarding some of the rules that are going to be in place. Some of the questions that have been asked: how long does Governor Kemp's executive order last? It is effective starting at 6 p.m. tonight, and it goes through 11:59 p.m. Monday, April 13th, 2020. What businesses and professionals must cease in-person operations and close to the public during this time? Bars, nightclubs, gyms, fitness centers, bowling alleys, theaters, live performance venues, operators of amusement parks, dine-in services at restaurants and private social clubs, with there being an exception for takeout, curbside, pickup, delivery, and dine-in services at hospitals, healthcare facilities, nursing homes, or other long-term facilities. Another business that must close: estheticians, in other words, waxing, threading, eyelash extensions, cosmetic treatments, hair designers, body art studios, also known as tattoo parlors, beauty shops and salons, including home beauty shops and salons, barber shops, cosmetology schools, hair design schools, barbering schools, aesthetic schools, nail care schools, and licensed massage therapists. And according to this, all other entities may continue to operate subject to specific restrictions. These restrictions vary depending on whether or not your entity is considered critical infrastructure. What does that mean? Critical infrastructure is a term that has been defined in the governor's order as a business that is allowed to continue to move forward. And I recognize this is not going to answer all of your questions. Again, that's why I turn people back to the Georgia Department of Economic Development 404-962-4000. It's going to be very important for you to get your questions answered by this state agency, which has been designated for the entire state. Additionally, the governor's order is going to be very similar in most respects to the order that we already had in place. It's going to address what travel is allowed. It is going to address what is critical infrastructure, which I just talked about. It talks about minimum basic operations like going to the grocery store and engaging in essential services. It is going to define those things, and we are working right now with our lawyers and with ACCG and a bunch of different other entities so that we can get this information out in plain English so that you can get your questions answered. We recognize a lot of times these documents are hard to understand. They contain a bunch of legal mumbo jumbo. We're working right now to get clear and concise information out to everybody. There's going to be a transition period. I just ask everyone to be patient. We're working around the clock to make sure that this information gets out in a clear and concise form. Additionally, yesterday, Governor Kemp announced that the Georgia Department of Community Affairs, the Georgia Department of Economic Development, and the Small Business Development Centers are partnering to make sure that every business in Georgia is aware of certain programs. And there are going to be webinars that are going to be held with respect to the CARES Act. And a lot of businesses are hurting. A lot of people have been laid off. The Albany Area Chamber of Commerce is going to be pushing information out to the public. If you have a business that has been affected, and everybody's business has been affected, I know thousands have been laid off in this community. Businesses have lost a tremendous amount of dollars, and that directly impacts how everybody feeds their family. We get that, we understand that. Please look to the Albany Area Chamber of Commerce, its social media pages, and its website for information on how the CARES Act, which was recently passed by Congress, how you may access different SBA loans, SBA grants, or other individual assistance that may help you and your business. That's going to be very important, and I want to encourage everybody here in Albany and Daugherty County, don't be bashful in educating yourself as much as you can. There are a lot of benefits that are out there to help us during this time and to help the entire country. We need to make sure that we're accessing every bit of it so that our community grows stronger and that we access all of that help. Everybody getting stronger and being able to sustain themselves helps the overall community, and that's most certainly what we want to continue to do. I also I want to say this. I want to thank our first responders. I want to thank our healthcare providers. They continue to work every single day around the clock, putting themselves at risk as a death toll continues to mount in this community, as some become overwhelmed by anxiety, and they get up every single day, they lace their shoes, they look into the mirror and they say, I'm not going to be afraid, and I'm going to try and make this a safer community. I want you to please think about them, pray for them, and consider them when you are deciding what actions you're going to take about whether or not to be a good or a bad steward of the responsibilities that we have placed upon us. Right now, we have to think of not just ourselves, and I want to say this. It's very clear that you can have the virus and never know it. You can engage in an activity as simple as touching something, and like I'll touch this podium, and as soon as I leave this podium, I'm going to go sanitize my hands. I'm not going to touch my face, but someone could literally touch something, leave some moisture, never know that they have the virus, and then perhaps an 85-year-old grandmother in that same house touches that, or perhaps you're too close and you're coughing on somebody at the grocery store. You can transmit the virus and ultimately impact whether or not someone lives or dies. That is a tremendous responsibility. We need to be cognizant of that, and we need to think about the lives that have been lost in this community as we determine how disciplined we're going to be, whether or not we're going to stand too close to each other in line, whether or not we're going to pack grocery stores, whether or not we're going to throw house parties or things of that nature. And again, I say all of those things recognizing that the large majority of our community has done a very good job in exercising the responsibility that we have as citizens to each other. Thank you.
Thank you, Mr. Chairman. At this time, we will hear from the Lee County Commission Chairman, Billy Mathis. Mr. Mathis.
Thank you again, Mayor Dura, for allowing us a forum to get a little information out to the folks in Lee County and the surrounding areas. The numbers in Lee County have been fairly steady for the last couple of days. We unfortunately had one more fatality that was identified today. So we're up to 8 fatalities in Lee County. A couple of things that I'd like to mention. There are a lot of questions, as both Chairman Cohilas and Mayor Dura said, about the governor's new order. Lee County has stood up our EOC, our Emergency Operations Center. The number for that is 759-6023, 759-6023. We'll have personnel in the center during business hours to answer as many questions as we can. Our folks have been working diligently to put together lists of frequently asked questions with answers. We've had staff, and as Chairman Cohilas said, the ACCG lawyers have done a very fine job of putting together some answers regarding the governor's new directives. We also continue to feed the families in need in Lee County. We did that on Tuesday during business hours. We'll do it again next Tuesday during business hours at the same location, the Vine in Leesburg. I believe that starts at 10 o'clock in the morning, and the folks will remain there so long as we have food to pass out. It's been very orderly. And on the subject of being orderly, I'd like to just commend the citizens of Lee County for doing what we think is a fine job in doing all of those things that they need to be doing to keep the community safe. I too knew Nancy Stevenson, Judge Stevenson, as most folks knew her, and I'd like to say there was not a kinder person on the planet. It hit home for me. I got a call at 12:35 the morning she passed. But it's also hit home to me something else that happened in Lee County, and I'd like to mention that. There are 2 families in the area of Lee County that I grew up in that both got on a bus, both families got on a bus and went to a church service. I had a call yesterday, and I've had a few calls prior about some of the family members, but I had a call yesterday from a family member that indicated to me that now everyone in both of those families is either infected or dead. Judge Stevenson's death hit me in the heart, but it also did for these 2 families that I know, that I grew up with. And the reason I say that is this: I would urge vigilance in staying at home, doing what you can to stay away from other people. I get a call almost daily from somebody saying, when can we go back to church? I want to get the parishioners back in my church. And I think about those 2 families, and I would urge everyone, even those pastors who tell me we know how to do this safely, to please urge everyone in your church to just give it a couple of more weeks. So let's stay home just a couple of more weeks. I mentioned to a pastor just this morning, I said, I don't so much worry about you knowing how you can do things safely at your church. What I worry about is the elderly lady who has been at home for 2 weeks, who now has decided she's going to leave her home and go to church, and then on the way home from church decides to stop by and see a friend who they think is home alone, or their aunt or their nephew, and then someone else get infected. So please, please, just for a couple more weeks, let's exercise social distancing, let's stay at home, and let's do all those things that we can do to make certain that we minimize any further damage. If there are any questions, again, 759-6023 in Lee County. That number will be manned during business hours, and if the folks there can't get you an answer to the question, they'll make certain that they call you back to get you an answer. Thank you so much.
Thank you, Mr. Chairman. At this time, we will hear from Phoebe Representative and Chief Medical Officer, Dr. Kitchen.
Thank you, Mr. McCoy. And what I will tell you in terms of our update for Phoebe Putney Memorial Hospital here in Albany and for our health system as well, the number of patients who test positive for COVID-19 continues to increase. I think that's partially attributable to the fact that we have testing capabilities in Albany and in Americus and in Sylvester that many communities do not have. But it's also reflective of the fact that person-to-person transmission in our community continues to be very, very prevalent at this point. That's reflected in the statistics that you see from the Department of Public Health, and I too will check their website on a daily basis. And if you take the Doherty-Lee counties in combination, the number of cases rivals that which you see in metro Atlanta at this point, and certainly on a per capita basis, really makes this from a hotspot standpoint, we have more cases per capita than any other area of the state right now. That's reflected on a national basis as well. And there was a recent article released by the New York Times that unfortunately puts Metro Albany in really having one of the highest COVID-19 rates per capita in the nation right now. And so I say this to underscore the message that you've heard from our mayor, from County Commissioner Cohilas, and from County Commissioner Mathis as well, that this is not a battle that's going to be won in our intensive care units. It's not a battle that's going to be won by hospitals and healthcare systems. The most effective way to really curb the rates of COVID-19 that we see are from personal responsibility and adhering to infection control measures and those public health measures that have been proven time and time again over the years to really be effective when you have a highly communicable infectious disease like COVID-19. So I will tell you, as of today, we've had a total of 837 patients across our health system who have tested positive for COVID-19. We've had 1,324 patients who have tested, who have tested negative for COVID-19. And we have a little bit over 1,200 tests that are still pending at this point. In total, we have had over 3,300 people who have been tested across our health system. And again, I want to emphasize the point that fortunately, testing has been much more available in our metro Albany community as compared to other communities. So I think you're going to see those cases continue to rise throughout the state and other communities as well as testing becomes more available at that point. I do want to emphasize we've had 152 patients who have been hospitalized with COVID-19 who have recovered and are at home. In terms of new development, I'm extraordinarily pleased to announce the fact that we now have in-house testing capability for COVID-19 at Phoebe Putney. It went live last night. It's functioned extraordinarily well and effectively thus far and has already been instrumental in allowing us to place patients in the most appropriate settings within the hospital. And I can tell you the intention of our CEO, Scott Steiner, is that we test every patient who comes in to Phoebe Putney Memorial Hospital in Albany and across our health system as well, for a couple of reasons. We have what we call patients under investigation, people under investigation, or PUIs. Those are people who are tested, but their testing results are still pending. We place them in the most appropriate care setting within the hospital that we can, but this will enable us to have a rapid test, and those test results will literally be available within a matter of hours. So for patients coming into our emergency room, we plan to have the results of those tests back, whether they have symptoms of COVID-19 or not, and make sure we place them in the most appropriate setting within the hospital to protect themselves, other patients, and our staff. And I think this will be one measure that will be very effective in terms of reducing the risk of hospital transmission of COVID-19. It will also enable us, for those patients who may need to go to a skilled nursing facility, a long-term care facility, to have the results of a test back before they're placed back into those facilities as well. The rate limiting step with this in-house capability is we have to have the testing kits, what we call a specimen collection kit. And we've only been allotted a certain number of those, but I will tell you that Mr. Steiner has been in daily communication with Senator Perdue, Senator Loeffler, and the governor to just make them aware that obviously due to the situation that we have in Albany in our health system, if we have more additional testing kits, that is going to drastically improve our ability to provide in-house rapid testing to every patient who comes in to Phoebe Putney and across our health system at this point. Additional developments. I will tell you, as of this morning, at Phoebe Putney, we had a total of 139 patients who have either tested positive for COVID-19 or whose tests are still pending. Of that 139, 57 have confirmed positive test, and 82 have tests who are pending. We're going to test all those patients who have pending test with the rapid test today. And so we anticipate by the end of the day, we'll know the status of all 82 of those patients, and we will place them appropriately. We have increased our ICU capacity. We brought on another dedicated ICU unit for patients who are positive or PUIs for COVID-19. So we've increased our ICU capacity for COVID-19 patients from 38 to right at 50 at this point. I will tell you that's the greatest need that we have at this point, is to have additional ICU bed capacity and staffing for that. We continue to see a large influx of patients coming into our emergency room with symptoms of COVID-19. A lot of those patients, unfortunately, have significant respiratory symptoms and compromise. So I will tell you, yesterday, we transferred out a total of 10 patients to other sister hospitals and surrounding facilities. Of those 10 patients, 9 of those patients required an ICU bed. So again, our greatest need at this point is to continue to increase the ICU bed capacity, and the physicians, the nurses, the respiratory therapists, and all the other staff that's required to effectively run an intensive care unit. Fortunately, the governor has approved the plan for us to open Phoebe North, which will be a total of 12 ICU beds, 15 general medical beds, so that will increase our bed capacity by a total of 27. And again, the biggest challenge is to really make sure that we have the staff, the physicians, the nurses, and so forth, to be able to effectively open that unit at Phoebe North. Realistically, we're looking at about a 2-week time frame on that. So again, that continues to be one of our most challenging areas at this point, is to meet the increasing need for bed capacity, and particularly for ICU bed capacity. There's a couple of very notable celebrations that I'm just really delighted to have the opportunity to share with you. You heard on Wednesday that we had a landmark event in terms of that we had our first patient who had required ICU admission, had required mechanical ventilation, had been on a ventilator, had improved, was able to be transferred from the ICU to general medical unit, and was discharged home. And I can't express how that really lifted the spirits of our staff. We've had a second patient who has been discharged home under similar conditions, and we anticipate that there will likely be a third patient today who's made that full transition from being on a ventilator in the ICU to being on a general medical unit, and will be returned home with family and loved ones today. We've had some additional patients within our ICU who have been extubated, who have successfully come off of a ventilator. And again, I simply cannot say enough about the tireless efforts of our ICU staff, working under extraordinarily difficult circumstances, putting themselves in harm's way, but really applying Herculean efforts to to really meet the needs of these patients. At the same time, you know, I want to be very transparent, and that the statistics for patients with COVID-19 who go into respiratory failure and have to be on a ventilator is a very, very sobering, very sobering statistic at this point. And again, you know, I think it really ties back to what we're doing to prevent these cases of COVID-19 occurring in our community. I also want to share with you, though, although these are events of tremendous celebration, we have to acknowledge the suffering that is occurring within the walls of our hospital, within the intensive care units, and within our community at large. I was up in the intensive care unit the other day, and that there was a nurse who came out of a room. And she was the only one present when that patient reached a point where all treatments and all efforts were futile, and performed what's called a compassionate extubation, where the breathing tube is removed. And that nurse was at the bedside to minister to the needs of that patient. And she came out, and unfortunately, you know, we couldn't embrace. All we could do was try to console her. And I mean, that's the efforts that these caregivers are putting forth every day. And I mean, that's just one example of the suffering that occurs. I want to say that Judge Stevenson was a very, very close personal friend. And that my wife and I have been, it's been a profound personal loss and source of grieving for us. And that she and John were very close personal friends, and throughout the years we really had we had the opportunity to share many great times together with our families. And I know we're all feel a profound sense of loss, but we need to acknowledge the suffering that is going on every day, because there have been way too many deaths. And you know, it takes, we have a resilient community, and I will tell you the resolve of the hospital is unwavering, but I cannot overstate the need for personal responsibility here. And I'm just going to leave you with one thing, because, you know, I think we all understand that we experience suffering and adversity during our human journey. It is part and parcel of the human journey, but we also acknowledge that we need to draw upon the strength of a higher power, and remember that God is with us and will sustain us through all human suffering. And that there's one particular scripture that is particularly meaningful for me, and it's from Romans 5:3-5. Suffering produces perseverance, perseverance character, and character hope. And hope does not disappoint us, because the love of God has been poured out in our hearts by the Holy Spirit, whom He has given us. So thank you today.
Thank you, Dr. Kitchen. At this time, we will hear an update from the Dougherty County Coroner, Mr. Michael Fowler.
Good evening. I want to give you a few updates pertaining to the COVID updates of the death of the residents here in Dougherty County. But before I give you those stats, I've been getting numerous of phone calls about funerals. Can we have a funeral after this order has come down today at 6 o'clock, or could the funeral workers work, or what could we do? So we know that a shelter is in place in order to begin today. Essential workers are still expected to continue their job as listed by the governor's office. Essential workers include workers who perform mortuary service, include funerals, homes, crematoria, and cemetery workers, as well as workers who coordinate with other organizations to assure the proper recovery, handling, identification, transportation, tracking, and storage and disposition of human remains and personal effects to clarify the death cause of death. So funeral homes will be doing their job, so you still can have a funeral. But many of the funeral homes now will have visitation or have viewing, but you'll be allowed still. You got to remember the number, the 10. You can't have no more than 10 people. So what they're doing is letting 3 or 4 come in at a time and go view. And before you view, they will sanitize your hand, give you some sanitizer in your hand, and you'll go view, sign the register book, and come back out, because other people would like to come in also. But they will not be coming in, sitting down in the chapel as a normal visitation. So that will go on. And also you remember the graveside service. And you got to remember 10 at the graveside. You cannot have a whole lot of people there. I know you want someone there to console you, and we sympathize with you during that time, but later on you may can have another memorial service where everyone can come back together after this season is over with. But right now we're saying just let's obey the order, because we want this virus to pass us at this time. So don't forget about the visitation. Like I said, a few at a time. So funeral will still continue on. Some of the stats that we have for today, I want to give you a breakdown. We have a total of 38 of Dougherty County residents that have died. We had, I got about 4 more, about 3 last night that passed. We waiting on, depending to see what their tests come back at that time. So a breakdown of the death that we've had. Many people have been calling what the ratio, who died, what the age. So this is a breakdown. We have 81% of the victims are Afro-American. 10% of the victims are Caucasian American. And 10, right now, we got 9 to 10 waiting on test results. We first got the call. The youngest is 34 years old. The oldest is 98 years old. And the average number is 72. 2% of the victims were in the 30s. 10% of the victims was in their 40s. 34% of the victims was in their 60s. 15% of the victims was in their 70s. 13% of the victims was in their 80s. And 5% of the victims was in their 90s. So we have a range from like I said, from 30 years old all the way up to 90. So the oldest one was, like I said, 98, and the youngest was 34, and the average person is 72. I want to thank Phoebe Putney for getting this rapid test in place, because many family members would call when I'm at the house or at the emergency room. They want to know is their family members have the virus, because I need to know what I'm going to do. So I want to thank them for pushing that, getting that going, Dr. Kitchen and the rest of Phoebe, because family members want to know. And then sometimes the co-workers want to know. I've been around that person, they died. Did they have the virus? They go to my church. I was with them at church. Did they have the virus? So the rapid test is going to be a great asset for us to get the test back done as quick as possible. I want to also, my condolences go out to the Stevens family. Judge Stevens, door rep around the corner from my door, and we work closely together in getting death certificate. And most times she had a lot of wisdom and knowledge. And so anytime I had a problem, I walked next door to her and asked her about what to do in certain cases. She had the answer. So my condolences go out to her and also the other 37 person that died, because I know all those families, all you are important. We know we mentioned Judge Stephen, but every one of you is important because you're somebody's mother, somebody's father, somebody's child. We want to say that our prayers go out to you also. So again, let's keep everyone in prayer and let's obey the order. And like I said, this season too will pass. May God bless you.
Thank you, Mr. Fowler. This concludes our press conference. I would like to leave you with a few thoughts. This disease, this pandemic, continues to rob our community of some of the most beloved family members and community members. This drives home the importance of each of us, everyone, doing what we can to stay safe and stay healthy. We will see you here next Monday at 1 p.m. Thank you.